Today, I will be presenting the yellow fever virus with you, with information obtained from the Centers for Disease Control and Prevention and from the World Health Organization. Some background on the yellow fever virus, or flavivirus, is that it is endemic in tropical and subtropical areas of Africa and South America. It is an acute hemorrhagic disease transmitted by mosquitoes, primarily the Aedes aegypti or the Haemomogus mosquito. This virus is acquired by the mosquito feeding on reservoir host species or monkeys. Some related viruses are the West Nile, St. Louis encephalitis, and the Japanese encephalitis virus. There are 3 transmission cycles: jungle, intermediate, and urban. The first jungle transmission cycle is transmitted between non-human primates and mosquito species found in the jungle canopy, then transmitted to humans working or visiting the jungle. The next is intermediate transmission cycle, which is only located in Africa. This can be transmitted from an infected mosquito to humans working in the jungle border areas, and can be transmitted from non-human primates to humans or from humans to humans by mosquitoes. And finally, the urban transmission cycle. This is the transmission of the virus between humans and urban mosquitoes, most often Aedes aegypti. This virus is brought to urban settings by persons infected in either jungle or savanna areas, so travelers. Here is a figure demonstrating the transmission cycles. Some signs and symptoms of the yellow fever virus. There is an incubation period of 3 to 6 days, and after that, initial symptoms that would occur would be onset fever, chills, severe headache, back pain, general body ache, nausea, vomiting, fatigue, and weakness. These initial symptoms usually resolve in 3 to 4 days and provide immunity to people who have been infected. Although rare, sometimes severe symptoms develop after the initial symptoms, which include high fever, yellow skin, bleeding, shock, or organ failure. If these severe symptoms occur, one would need to go to the nearest emergency room to seek care. Diagnosis. There are only 3 ways to diagnose the yellow fever vaccine. One is by laboratory testing, person's symptoms, and taking a travel history. High-risk groups. Travelers are among the high-risk groups and those living in high-risk locations. There are 47 countries in both Africa and Central and South America that are affected by the yellow fever virus, as seen in these pictures. Prevention strategy. The first prevention strategy is to avoid mosquito bites. Using insect repellent, wear proper clothing to reduce mosquito bites, and to prepare for mosquito hours, which are at dawn and dusk. The second and probably most important prevention strategy is vaccinations. If you are traveling to high-risk areas in South America and Africa, it is suggested to get this vaccination. This vaccine provides effective immunity within 10 days for 80 to 100% of the people vaccinated, and within 30 days for more than 99% of the people vaccinated. Although currently the yellow fever vaccine is in shortage, so if you are wondering about trying to get this vaccination, please contact your local public health office for a list of clinics that carry this vaccine. Case management. There is no medicine to treat or to cure the infection from the yellow fever virus, although there are recommendations for supportive treatment by the World Health Organization. Resting, increasing fluid intake, and treating symptomatically are all suggested. You would want to avoid NSAIDs or nonsteroidal anti-inflammatory medications because they increase the risk of bleeding. These NSAIDs include aspirin, Advil, and Aleve. Thank you.